Cardiovascular disease is the #1 killer of people with diabetes. The American Diabetes Association recently updated the standards of care for those with diabetes. And Dr. Robert Bush joins us now to discuss what steps patients can take to improve their heart health. Welcome. So tell us, what should people with diabetes know about the risks to their heart?
Patients with diabetes are at 2 to 4 times the risk for their heart, and that's even though they're taking the appropriate medications like a blood pressure drug or a cholesterol drug like a statin. They still are at much higher risk of a heart attack, stroke, or dying from cardiovascular disease.
What are some of the new recommendations for treatment then?
So the new recommendation is go beyond statin therapy. Know another fat in the bloodstream called their triglyceride level. And if the triglyceride level is elevated, there's a medication called icosapent ethyl, trade name is Vascepa, that will lower their risk of heart attack, stroke, or dying. A very large study came out at the heart meetings in November and is now a standard of care from the American Diabetes Association. Know your triglyceride level, and if it's 135 or higher, you should be on Vascepa, not just a fish oil food additive or a generic fish oil. This is a specific type of omega-3 called Vascepa that has an EPA fish omega-3 in it that has been shown to lower the risk of heart attack, stroke, or dying. That's the new standard of care.
So how can people with diabetes already improve their overall heart health?
Well, Elsa, what they would do is diet and exercise is important. Know their LDL cholesterol and be on a statin, a cholesterol-lowering drug. Be on blood pressure drugs that help them, and keep their weight down would be important. And know their triglyceride and treat that appropriately, as we've talked about with Vascepa.
And what exactly should people be discussing with their doctors?
They should discuss what is their ideal weight. What is their blood pressure? Is their blood pressure down? Should they be on medication for that? Is their LDL cholesterol down? And it should be on, they should be on a statin therapy, and know their triglycerides and be on appropriate medication for that as well. And of course, the importance of lifestyle, diet and exercise, avoiding the high-fat foods, things like that.
Where can we go for more information?
This could be, for the drug itself, would be Vascepa.com. For heart health and diabetes in general, could be diabetes.org or theheart.org.
Dr. Bush, thank you so much for being with us here today, and we will be right back with more Midday Maryland right after this. Stay tuned.